Today's video is entitled Surviving Heart Attacks, the Importance of Cardiac Collateralization. The heart is a muscle, and any muscle requires a blood supply to function. The heart is supplied by two main blood vessels, the left coronary artery and the right coronary artery. The left will further divide into two large branches, the left anterior descending artery, that is also known as the LAD, and the left circumflex artery. Each of these vessels will supply a part of the heart, and in combination these three vessels supply the whole of the heart. When any of these vessels is occluded, the territory supplied by that vessel no longer receives the oxygen it needs, and the cells within that territory will suffocate, and if the occlusion persists, these cells will eventually die. When the cells die, they are no longer able to contribute to the pumping ability of the heart, and the heart function will decline. It is therefore logical to say that the single most important factor in terms of prognosis from a heart attack is the size of the affected territory. The larger the territory that dies, the weaker the heart gets. The consequences of death of a large territory include death of the patient, or if the patient is lucky enough to survive the heart attack, they will be left with a severely weakened heart, and that in itself points to a very dim overall prognosis. Now, if the areas within the heart were to receive blood from multiple arteries, and therefore were not dependent on a single vessel, then even if one vessel blocked off, the amount of damage would be minimized because cells within that territory would continue to receive some blood from the other artery.